Good morning to everybody. Dear colleagues and friends, for those of you who do not know me, my name is Paul Werker. I'm a plastic surgeon and I'm the head of the Department of Plastic Surgery here in this beautiful hospital. And I will be your local host. So if there's anything you need me in the coming days, please do not hesitate to contact me or ask the ladies, of course, at the registration desk, and we'll try to help you as best as possible. Over the past 25 years, I've witnessed major changes in our thinking, our understanding, and our treatment of Dupuytren disease. I personally became involved in research in the field when I was introduced by Dr. Lermougeot in Paris to needle fasciotomy at the end of last century. I had the pleasure to observe how he did that, and I was really fascinated by the results that he achieved. And I took it back to the hospital where I was working at that time and immediately started practicing it myself. And then I embarked on research, first a pilot study, and then I started the randomized clinical trial that lasted for 5 years. And then early this century, I had the pleasure of meeting Professor Roel Ophoff, who is also here. And together we embarked on a major genetic studies, which in 2010, when we came together in Miami, turned into an international collaboration with a group of Dominic Vernis and Hans Hennies. And that work has also been published very highly in the New England Journal of Medicine. And of course, you can imagine that I'm very proud that was what happened. And the most important thing that I want to say about that is that I hope that this meeting today and tomorrow will also result in collaborations like that, and I hope that you will be able to renew friendships and make new ones. When I had the opportunity to organize this meeting, I was, as you can imagine, thrilled that we as a team of experts could come together, share our knowledge, and further the Dupuytren research. And it is a great pleasure, therefore, to welcome you all to the second International Dupuytren Conference that is organized, and that is quite special, I think, by the International Dupuytren Society, which is a patient society, and it's, of course, hosted by the hospital here in Groningen. The response to our call for abstracts was absolutely more than we expected. We received over 100 papers, and a team of about 20 reviewers helped us to blindly review all those abstracts. And that ultimately led to the program that we are having these Tuesdays. The atmosphere at conferences can be quite formal. And I've been approached by some of you asking what the dress code would be. And I replied to them that that is absolutely to your own discretion. So if you come here in shorts, fine to me. If you like to wear a tie and suit, fine to me. So I would love to have the atmosphere here as informal as possible, to once again stimulate everybody to talk to each other and make new plans for the future, because we'll absolutely need one another to bring the Dupuytren research further, because it's very difficult, as we all know, to get funding for it. So before I give the floor to the founding fathers of the meeting, Wolfgang Wach and Charlie Eaton, it's my pleasure to introduce Jos Aartsen. He is the CEO of our University Medical Center, and he has a vast experience with Dupuytren disease himself. So Jos, please come to the floor. And I wish you all a very inspiring meeting. Thank you very much for coming.
Ladies and gentlemen, welcome, of course, in Groningen, and of course, welcome in our university hospital. You have traveled from all corners of the world to the northernmost province of the Netherlands to be our guest here the next 2 days. We are delighted to welcome you and proud that we were chosen to host this event, beating off competition from wonderful cities such as Oxford and Budapest. And rightly so, Groningen has much to offer. Those who came here by train cannot have failed to notice the world-famous Groningen Museum opposite the station. And the Martini Toren that was dominated the skyline of Groningen for more than 500 years is also very difficult to miss. As you will only be here for a few days and probably haven't time to study the facts and figures of our city, allow me to give you a brief rundown in the form of everything you always wanted to know about Groningen. For example, did you know that you are in the city with the highest percentage of students in the Netherlands? A staggering 1 in 5 of the population in Groningen is a student. And did you know that our university has produced not only 3 Nobel Prize winners, but also the first female medical graduate and the first Dutch astronaut? But by far the most important thing you need to know about Groningen is that it is the happiest city in the Netherlands and an example region in the field of active and healthy aging. A remarkable 97% of the population is satisfied with life here in Groningen. And according in the European Commission, the North Netherlands is one of the top regions when it comes to active and healthy aging. So in short, you not only have a good chance of being happy in Groningen, but also of growing and healthy. The University Hospital employs more than 12,000 staff to work on patient care and pioneering scientific research. More than 3,700 students are training to become doctors, dentists, or movement scientists. And some 450 doctors are training to become medical specialists. We are helping to build the future of healthcare to the 3.5 million people living in the north of Netherlands. Our focus is on healthy aging. How can we make sure that people continue to stay healthy and play an active role in the society? We have taken things a step further than the traditional approach of treating people and helping them to recover. We study the causes of aging and provide people with information about health, prevention, and quality of life. Patients come to this university medical school. To this, how is it possible? Patients come to our hospital for basic care, but mainly for highly specialized diagnostics, examinations of treatment for complex or rare disorders. Research, education, and training are combined with the best possible patient care in our comprehensive centers for plant transplants, oncology, and emergency care, each separate discipline reinforcing the other and generating innovation. I could say a lot more about UMCG, but you came here today to hear about the latest developments in the research on and treatment of Dupuytren. And as you will know, this is not my specialist area. I do, however, feel strong ties with the conference, and I'm particularly interested in the conclusions. I am, in fact, a hands-on expert, not only as a patient, but also as an instigator of research into Dupuytren. Let me explain. As a patient, I found myself in discussion with Paul Werker. I was bold enough to cast doubt of the widely accepted theory that Dupuytren is mostly hereditary. I am the only person in my family to be afflicted. I suggested to Paul that there could be a link between developing Dupuytren and playing hockey with a stick. Anyone who plays hockey will immediately recognize the vibration you feel through the stick when you hit the ball. Paul Werker was not far from convinced. Several weeks later, I was astounded to hear that a trainee specialist in the UMCG had given the go-ahead to research my hepatitis. And as I turned out, this disorder was indeed significantly common among male hockey players at the Dutch Veterans Tournament when the trainee did his research. Whatever else, Paul Werker's broad-minded attitude resulted in an interesting PhD project. So now you understand why I feel involved with the conference and the conclusions you reach. Who knows, they may even help me. I would like to wish you the very best at this conference and hope that you will have the time for a good time in the UMCG and, of course, in Groningen. That will be that it will be a source of inspiration. I would like to compliment the International Dupuytren Society on the interesting varied program it has compiled for you. I started by telling you that Groningen has a lot to offer. So it's only fitting that I conclude with a well-known Dutch saying, which I'm sure you will endorse at the end of the conference. Nothing beats Groningen. Thank you.